Hi everybody, my name is Dr. Hilary Booth. I'm a naturopathic doctor and welcome to my video blog. Today we're going to be talking about insomnia. This is something I see a lot in my practice and it's something that a lot of people brush off as being of no importance, but it really is something that you should be focusing on if you're going to have good overall health. So I see a couple different kinds of insomnia in my practice. The first kind of insomnia is the inability to fall asleep. So this is defined usually with the inability to fall asleep within the first 15 to 30 minutes of going to bed. The second kind of insomnia that I see is maintenance insomnia. So this is where you're waking up in the middle of the night, sometimes more than once, for no real reason at all. The third kind of insomnia that I see is non-restorative sleep insomnia. So you might get a full good night's sleep, but you still wake up and you're not feeling as though you're well rested. So there are a couple of different things that I always look into when I have somebody in my practice with insomnia. The first thing that I look into is their stress levels. So what should be happening in your life is when you wake up in the morning, we have a stress hormone called cortisol. The cortisol should be at its highest level when you wake up in the morning, and then as you go through the afternoon, it should go down a little bit and should peak mid-afternoon and then go down as we go toward night. At nighttime, we should have a different hormone that picks up instead called melatonin. Melatonin should be around at night. That inhibits the cortisol hormone, and melatonin also has a bunch of other great things that it does, including cancer prevention, but we will talk about that in another video blog. So if you are someone who experiences chronic high levels of stress, your body may not be coping very well. You might have really high levels of cortisol throughout the entire day, and they're not dipping down at night to let you go to sleep. The other kind of thing that I look for are food intolerances. So sometimes these can contribute to non-restorative sleep or feelings of fatigue throughout the day. If you would like, you can look at my other video blog on food intolerance to learn more about that. Along with food goes blood sugar dysregulation. So sometimes we see people whose blood sugar is going like this, up and down throughout the day. So naturally when you go to sleep at night, your blood sugar crashes and you wake up. The other thing that I often see with people is poor sleep hygiene. Sleep hygiene is sort of the general term that we use to describe the conditions around going to bed. So the first thing that's very important to do is to make sure you have a dark room to sleep in. This means turning off your alarm clock lights that are blaring at you. Maybe flipping over your cell phone and turning it on to the do not disturb so that it wakes up in the morning but there aren't any flashing lights in the middle of the night. This means blackout blinds in your room. For me, this is impossible. I live in a condo. I'm not going to pay to put blackout blinds in, so what I do is I wear a sleep mask at night, and that works really, really well. The next thing that's important about sleep hygiene is making sure your bedroom doesn't have any clutter. So the physical clutter in the room, sometimes your body internalizes that and it prevents you from getting a restful sleep, or it makes it difficult for you to fall asleep in the first place. So this means putting away books, maybe getting some sort of a closed shelving unit that's not open and exposed. It means putting away clothing, finding somewhere to put it so that it's not all sort of thrown around. The next thing to really look at when it comes to sleep hygiene is whether or not you have a good bed. This is something that you hear ads on the TV all the time, but it really is true. You have to have a good mattress and a good pillow that's properly suited to the way that you sleep. Something else that I always look into is whether or not someone is experiencing restless leg syndrome. So if you have a bed partner, they may be able to tell you that you're flailing around at night, or you may know for your own self. And there are supplements that we can give you that 9 times out of 10 I see it completely remit the restless leg syndrome without any problems at all. So if that's something that's for you, then please give me a call and we will look into that. The other thing that's important with your sleep hygiene, as I mentioned before, is your blood sugar. So it's important not to be eating a big carby snack right before bed, as that can cause a spike in blood sugar and then a subsequent crash throughout the day. There are also other things that we can do as naturopathic doctors if we've sort of checked off all these boxes and gone through your sleep hygiene and gone through your stress levels, those sorts of things, to help you get into a more relaxed state for sleep. So we can do acupuncture, which over time can reduce stress. We can do deep breathing. I can teach you how to bring your body from a state where your brain waves are up here to a state where your brain waves are a lot more calm and ready for sleep. We can also do different supplements that are going to help to reduce some of those mind churning thoughts that are going on if you have racing thoughts or anxiety before bed. We can also give you supplements if we need to reset that clock where I spoke about before, where it should be cortisol during the day, melatonin at night. Sometimes these things just aren't in cycle the way they should be, and we can get those back on track. There are also some lab tests that we can always offer. If you'd like, you can do an adrenal stress panel, and that is a saliva test that lets us know how high your cortisol is at 4 different points throughout the day, which is a great indication to show us whether or not you're having that proper cycle that's going to then lead toward having a more restful sleep. I hope this information was helpful for you. If you have any questions at all, please go to my website at www.hillarybooth.com. That's HILARYBOOTH.com. There's my contact page, and you can always go to my contact information there and send me an email through that, or you can give the clinic a call or book your appointment online, and I'd be happy to speak with you or do the adrenal stress test with you in person. Thanks very much for watching, everybody. Take care.